Okay, so this presentation is feedback on the practice bank that I've given you on the cervical spine. So I hope that you have completed the preliminary image evaluation form. Please keep it at hand as you go through this presentation. So for case 1, we have the clinical indications of an 87-year-old who fell and who is complaining of upper neck pain. As you are aware, when our patients are very elderly, we really struggle to get very good x-rays of the cervical spine. So unfortunately, there is no open mouth on this case. The AP view doesn't tell us much, but the main one is the lateral view. So if we look at the lateral view, we should be able to see that there is a fracture at the base of the odontoid process, and there is some posterior displacement. There's also severe degenerative disease with severe disc space narrowing at the level of C4 and C5. So for our preliminary image evaluation form, so if we just go down, clearly this case is abnormal. The alignment is abnormal because of the posterior displacement. The bone is abnormal because of the fracture, and of course the cartilage and joint is also abnormal. So your overall comment should be that there is a type 2 odontoid fracture with posterior displacement. There's evidence of degenerative changes with severe disc space narrowing, and this is in particular at C4, C5, and there's degenerative anterolisthesis of C4, C5. Now moving on to case 2. So with case 2, we have a patient who was involved in a car accident where the airbag deployed and now has diffuse tenderness over the cervical spine, and they were querying whether there is a fracture. So in the open mouth view, we can see that there's good alignment on both the lateral masses if you compare to the dens and to C2. On the AP view, there's also all the line seems to be intact. And then on the lateral view as well, there's no steps in any of our lines, like our posterior vertebral line, our spinal laminar line, and the spinous processes follows a gentle curve. So this case is normal. So with this case then, in the general opinion, you need to tick that it is normal, and then if you want to, you can tick all the normal boxes, but that's not necessary, and then the overall comment is normal. It's important when you write the exams that you actually provide a comment, although you have ticked the general opinion box to indicate that it's normal, because as mentioned before, the overall comment attracts 1 mark. For case 3, we have a patient with lower neck tenderness and there is no history of trauma. If we look at the spinous processes, we can see that there is a fracture of the spinous process of C7, which is quite typical of a clay shoveller's fracture. There is some degenerative changes as well to the cervical spine, but that's not related to trauma. So for case 3 then, it's abnormal, and the bone is abnormal, and it's a clay shoveller's fracture of C7. For case 4, we once again have an elderly patient who's had an unobserved fall and is now complaining of neck pain. So on the lateral view of the neck, we can see that there is between C1 and C2, there's a dislocation between the atlantar and the axial spine. There's also marked degenerative changes throughout the spine. So for case 4, then it's abnormal. The alignment is abnormal, the bone is abnormal, and I think I should have also ticked off that the cartilage and joints is abnormal. And then the overall comment should be that there is a C1, C2 dislocation, or you could write an atlantoaxial dislocation, and there's also marked degenerative changes throughout the cervical spine. So for case 5, this is a patient who has had a diving accident, and if we look at the alignment, we can see that the lateral masses of C1 is overhanging C2. We can also see that there's a marked increase in distance from the dens to that of the lateral masses, and this is indicative of a Jefferson's fracture. So your tick boxes then, it's abnormal, the alignment is abnormal, the bone is abnormal, and it affects the cartilage and joints. And your comment should be that it's a Jefferson's fracture, or you could write a C1 fracture with overhanging lateral mass and increased space between the peg and the lateral mass on the right side. Apologies, I need to open up case 6. So for case 6, we have a patient again who has been involved in a car accident, and here we can see the patient has a collar on. So on the lateral view, if we look very carefully at C2, we can see that there's a flexion teardrop in the anterior inferior corner of the vertebral body, and there is also some prevertebral swelling as well. So then for case 6, it's abnormal, the bone is abnormal, and also the soft tissue is abnormal. And your comment should be that there's a flexion teardrop fracture of the C2 vertebral body with pre-cervical soft tissue swelling. Our final case, and there's 2 images, and the main image that I'm going to focus on is of the lower cervical spine. And once again, if we look here at the level of C7, C6, there is a unilateral facet dislocation. It borders almost on bilateral, but it's about 40% of forward movement of C6 on C7. So for this case then, it's abnormal, the alignment is abnormal, cartilage and joints abnormal, and your comment is a unilateral facet dislocation of C6, C7 with approximate 40% forward movement of C6 and C7. Thank you.